start by washing my hands. Hi, my name's Maddie. I'm a family nurse practitioner student. Today I'd like to do a full head-to-toe assessment on you. Do I have consent to do that?
Yes.
Okay, great. Can you tell me your name and date of birth?
John McDermott, 7/10/98.
Okay, great. So first we would start by checking your vital signs. I don't have any tools here, but we would do your temperature, your oxygen level, we would do your blood pressure, and then I don't have a clock in here, but I could get your heart rate, just count it over 60 seconds, and then we could get your respiratory rate. We would just count that over 60 seconds as well. Are you in any pain right now?
No.
Okay, great. So we'll start with just your general appearance. Overall, you look well kept. Your speech is clear when you're talking to me. Your behavior is normal. You don't appear to be underweight or obese. Your nutritional status looks good. Next, we will move on to your head, eyes, nose, and throat. First, just start by inspecting your whole head. I don't see any lumps, any lesions, any rashes anywhere, no deformities. Is it okay if I feel?
Mm-hmm.
I'm gonna palpate, feeling for any deformities, any pain. Are you having any pain anywhere?
No.
No. Okay, good. Now we'll look at your face, looking for any deformities, which I don't see any. Your face is symmetrical on both sides. Now we're going to check your eyes. We can start with a visual acuity test. So I'll just have you cover one eye, and then I'll have you read the lowest that you can read.
LTFPH.
All right, and now I'll have you do the other eye.
LTFPH.
And now both eyes.
LTFPH.
All right, good. And then just looking at your eyes. It's nice and pink in there. Alright, good. Your pupils are equal, round, and reactive to light. Now, I'm gonna look at your ears. Looking on the outside, I don't see any deformities, no lesions, nothing concerning. I'm gonna take a look in your ear now. Alright, so looks good. I could see that your tympanic membrane is nice and pearly white, and I could see the cone of light, and then I would do the same on the other ear. I'm going to test your hearing. Can you cover that ear for me? I'm going to whisper. Just tell me what you hear.
Sun.
Now cover the other ear.
Book.
Alright, perfect. Now we're going to look at your nose. Looking at it, there's no deformities, everything is even. We're gonna look for any drainage or any redness, which is good. I don't see any. And lastly, we're gonna do your mouth. There's no rashes on your lips, there's no bumps, there's no, nice and intact. Can you open your mouth? Pull your tongue back in. Just open. Everything looks good, no lesions, nothing like that. Now I'll have you stick your tongue out and say, Alright, everything looks good in there. Your tonsils are enlarged. Your uvula rises. Now, are you able to swallow? Alright. good. Now I'm gonna feel your lymph nodes. Let me know if anything hurts. I'm also feeling for any enlargements. Any tenderness with any of that?
Nope.
Alright, good. Perfect. Next we're gonna move on to the cardiac assessment. So first inspecting you, I don't see any jugular vein dissensions. I would have you show me your chest more, but I'd be looking for any abnormal pulsations, anything like that. I'm gonna take a listen. Gonna listen the aorta, the pulmonic, tricuspid, and the mitral valve. Which just sounds good. I'll turn it around and listen with the bell as well in the same areas. So I heard S1 and S2, no murmurs. Can I see your hands? That one too. Very good. So your capillary refill is less than 3 seconds. I would do the same thing on your toes, but I won't make you take your shoes off. Feel your pulses. They're +3 on both sides, and they're even. I would do the same, check the capillary refill on your toes, on your toenails, and I would check the pulses on your feet as well. And then, just looking here, I don't see any edema, no swelling, nothing like that. Next, we're gonna move on to respiratory. So for this, I would be looking at your chest again, looking for symmetry, looking for good chest rise and fall. I would look from this side and make sure that there was no barrel chest. Tell me if you feel any pain. I'll palpate the chest. No?
Nope.
Alright, now we're gonna listen. Are you able to come out just a little bit so I can listen on your back? Can you take some deep breaths for me? Okay. So your lungs are clear throughout. Next, we're going to move on to the abdominal assessment. I don't think you'll fit laying, will you?
Perfect.
I'll just pull it, untuck this. Alright, so looking, I don't see any distension, any abnormal pulsations or movements or anything. Is it okay if I feel?
Mm-hmm.
We'll do light palpation first, feeling for any tenderness, any masses or anything. I don't feel anything, any pain.
Nope.
Okay, now we'll do deep palpation, feeling for any deeper masses, hernias, which I don't feel any pain.
Nope.
I'm gonna take a listen. Gotta listen in all 4 quadrants for so there were vowel sounds present in all 4 quadrants. Now I'm gonna listen for any bruits over the aortic region, renal, and femoral. Which I don't hear any. You can sit back up. Now we're gonna move on to musculoskeletal. I can see that your posture looks good. None of your joints, your elbows, your wrists, your fingers, your knees, nothing looks deformed. We're gonna do some range of motion. Can you move your wrists, move your elbows, lift out your shoulders, and then you're able to stand up. You're able to bend over, and can you squat down a little? All right, good. You can sit back down. So your range of motion was good. Now we're gonna test your strength. Can you squeeze my hands? Can you pull me towards you? And can you push me away? Great. Can you do the same here? Push me away. This side too. And then towards you. Good. And then we could do your feet too. I would put them on my hands and have you push and then pull, but you have shoes on. Now we'll test your reflexes. First, well, actually this isn't gonna work. I would have you sitting up higher with your feet dangling, and then I could test your patellar reflex. We can test your radial and your brachial though. Alright, good. And I would do the same on the other side too. Next would be your neuro assessment. So just from talking to you, I can tell that you're alert. Do you know where you are right now?
Yep.
Where?
New Bedford.
And what's the year?
What was that?
What year is it?
2026.
Okay. So you are alert and oriented times 4. We don't have. Yeah. We can. I'll have you shut your eyes, and then I'll have you tell me if what I'm touching you with is sharp or if it's soft.
Soft. Sharp. Soft. Sharp. Sharp. Soft. Soft. Sharp.
Okay, good. Now we would test temperature. I have something cold. I'll have you close your eyes and then tell me if you can feel this.
Cold. 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 Cold.
Yeah, great. I would do the same thing with something hot as well. Now we're going to test vibration. I'll have you close your eyes again and then tell me if you feel it vibrating.
Yes. 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 Yes.
Perfect. And then I'll just have you stand up, and if you can just walk to here and back a little. And back. Alright, good. You can sit back down. You have good gait, good balance. Lastly, for neuro, we're going to test your cranial nerves. The first one is cranial nerve 1, olfactory. Can you shut your eyes for me? Nice. Hold on. Okay, I don't have anything for you to smell right now, but I would have you close your eyes, put it under, you can open your eyes. I would put it under your nose and just have you tell me what it smells like. Next, cranial nerve 2. We already tested your visual acuity, but we can test your visual field. Just follow my finger. Alright, good. Next would be cranial nerve 3, 4, and 5. But we already checked your pupils. We know that they're reactive to light, so we don't need to do that again. Then it would be cranial nerve 5. Can you close your eyes? Can you feel this?
Mm-hmm.
Can you feel that?
Mm-hmm.
Okay, good. And then can you clench your teeth? Right, good. Next is cranial nerve 7. Can you raise your eyebrows for me? And can you smile? Good. Next is cranial nerve 8. We already did the whisper test, which is what you would do for that one. Cranial nerve 9 and 10 would be testing the gag reflex, but we won't make you do that either. And it's also the uvula rise, which we checked when we looked in your mouth, so that was good. Cranial nerve 11, can you shrug your shoulders? And then can you turn your head towards my hand? And then again, good. And then the last one is cranial nerve 12. Can you stick out your tongue? Okay, and that was symmetrical. We will move on to your skin. I can see that you have good color, you're not jaundiced or anything. Feel that you're nice and warm, your skin is dry. I would obviously inspect all of your skin, but from what I can see, there's no lesions, rashes, nothing like that. I would also look at the skin on your scalp, which we can see. We would check for hair distribution, but there is none. And then for endocrine, just gonna check your thyroid. I'm gonna palpate, feeling for any lumps, which I don't feel any. And we already checked your lymph nodes earlier, so I think that is it.